Hello all. Today the topic of discussion is ADHD, that is Attention Deficit Hyperactive Disorder, a much awaited topic. ADHD is a neurobehavioral disorder which is commonly diagnosed in childhood and sometimes may persist till adulthood. If you notice, most of the children, they are very active and hyperactive at certain age. So we randomly say this child is ADHD. All children, that they cannot be categorized ADHD that way. To say ADHD, there should be persistence, inattention, hyperactivity or impulsivity which is interfering the daily function of the child. Then only you can say this is ADHD. So let's see how it is diagnosed and what it is and how that can be managed. So ADHD is most common neurobehavioral disorder occurring in 3 to 10% school children, and male to female ratio is 3:1. The worldwide prevalence is 3 to 13%, and only in India the prevalence is 2 to 17%. Now come to the etiology, why this is occurring. Number 1, cause is neurobiological differences, or this means there is dysregulation of dopamine transmission to the frontal cortex. Dopamine, this is one of the neurotransmitter which is involved in attention regulation, impulse control and decision making and motor activity. So when there is dysregulation of this dopamine, the availability is less. So there is reduced transmission of this dopamine to the key centers of the brain, that is mainly the prefrontal cortex. So because of this, ADHD occurs because there is a disbalance. Number 2 cause, genetic cause. In the genetic factors, 70 to 80% is the heritable. So there is a very strong genetic predisposition of this condition. So there can be genetic variants in the dopamine gene, and then the mutation can occur in certain conditions which may lead to deficiency of dopamine. And next is environmental factor, prenatal exposure to tobacco, alcohol or lead. In the mother, if the mother is smoking, is alcoholic or is given lead at some medications, then there is a high chance the child might have ADHD. Because this tobacco, alcohol, lead, all these products, it disrupts the normal brain development in a fetus, which means it alters the dopaminergic pathways. So there is decreased availability of dopamine. So ultimately there is dysregulation of the attention and there is dysregulation of the motor activities. And especially if there is a genetic predisposition, the child is having a genetic factor, and then when it is mixed with environmental factor, the incidence is much higher. And there are some other neurological or psychiatric conditions like sleep disorder, epilepsy, learning disorders. These conditions may have similar symptoms as ADHD, and sometimes it may coexist also with the ADHD. So when the children are having these features, you have to investigate for these conditions also. Now, definition by DSM-5 criteria. So DSM is Diagnostic and Statistical Manual of Mental Disorder edition 5, published by American Psychiatric Association 2013. According to this, ADHD is characterized by persistent inattention, hyperactivity impulsiveness. So these 3 findings should be there, and according to this they have made some subtypes. So in this, number 1, predominantly inattention, known as ADHD-I. In this, more than 6 symptoms of inattention. These symptoms I'll be discussing in my next slides. So there should be more than 6 symptoms of inattention and less than 6 symptoms of hyperactivity, impulsivity. And this type is uncommon. ADHD-I is uncommon. Number 2 type is predominantly hyperactive impulsiveness is there, so known as ADHD-HI. So here there are 6 or more than 6 symptoms of hyperactivity, impulsivity, and less than 6 symptoms of inattention. And number 3 is combined, that is ADHD-C. So this is the commonest type of ADHD we see. So in this, 6 or more than 6 symptoms each of both inattention and hyperactivity, impulsivity should be there to say this is a case of ADHD. So we'll see what are those criteria. So for diagnosis, the symptoms, all these inattention, impulsivity, and then hyperactivity, those symptoms should at least be present for consecutive 6 months, and the onset should be before 12 years of age. Another point, symptoms should be present in 2 or more settings. Examples may be home, school, or in some healthcare centers, so that people notice. So in 2 settings these children should be having these symptoms. In a child who is less than 12 years old and then persisting for 6 consecutive months. And all these symptoms should impair the ability of the child to function normally and must not be secondary to other disorders. So these are the specific criteria which is required. And then if child is showing all these criteria for more than 6 symptoms of each category, inattention, hyperactivity, impulsivity, and then persisting for consecutive 6 months, then you can say this child is having ADHD. So repeated sitting you have to assess the child. Okay, now let's see the criteria which I have mentioned in my previous slides. The criteria first, I'll discuss the criteria for inattention. So out of all these 9 criteria, 6 or more than 6 symptoms should be persisting for 6 consecutive months. So number 1 criteria, a child making careless mistakes in school, work, or other activities. Number 2, difficulty sustaining attention in task or play activities. Very difficult to sustain the attention because they have very short attention span. Number 3, not listening when spoken to. You go on telling the child not to do, he'll continue doing his own ways. Number 4, does not follow instruction and fail to finish schoolwork and other tasks because the child is not following the instructions. And there is difficulty organizing tasks. So this means the child is failing to, or they struggle to make a planning or planned or sequencing or prioritizing the work. If you have to plan some work according to the plan or according to the prioritization, this child cannot do the task. Number 6, avoiding activities which require sustained mental effort. They don't want to think hard. And then 7, losing things necessary for task or activities, like they easily lose pencils, books, toys. There are children who show this type of activities. Number 8, easily distracted by external stimuli. And number 9, often forgetful in daily activities. So the child cannot function normally because of all these points. Now come to the diagnostic criteria for hyperactivity and impulsivity. So from here also 6 or more than 6 symptoms should be there for 6 consecutive months. So feature of hyperactivity. Number 1, fidgets with hands or feet or squirms in the seat. So when the child is sitting, you notice when a child with the hyperactivity come when you watch the child sitting in the chair or sitting somewhere. The child will continue tapping their fingers, shaking their legs. They go on shifting constantly in the chair, and it's very difficult for them to sit very still. They start drumming fingers on the desk, so that way they continue the movements in the seat. Number 2, fail to remain seated in a expected seat in the classroom. So when the child is sitting, the child suddenly gets up frequently because the child can't sit still in the seat, in the expected seat. And then number 3, inappropriately running around, jumping, climbing. You see, these children are climbing, jumping everywhere, and then when not appropriate. When they are playing and jumping and climbing, this is okay, but while teaching also, the child will just stand up and start climbing, goes and climbs the window or runs around constantly because they are feeling restless. Number 4, difficulty in engaging in activities, difficulty in playing quietly. They cannot play quietly, they just move on. And number 5, always on the go. So always ready, and then to have a constant motion because they are not sitting still, they have a constant motion, and then they run in the classroom, and when they are having meal also, they just have meal and then again start and run and go and do something else. And number 6 is talking excessively, continuously talking. And now features of impulsiveness. Here they cannot wait for their turn, so they blurt out answer before the question is completed. And difficulty waiting one's turn. So suppose the teacher is asking turn by turn, so before his turn comes, he starts speaking, or he starts running or taking the things. Or you tell the child to stand in a row and then wait for their turn, they cannot wait for their turn. And then they interrupt on others. So when you're talking, they interrupt over there. So these are the criteria for hyperactivity and impulsiveness. So when you diagnose, you have to carefully look at all these criteria of inattention, hyperactivity and impulsiveness. So clinical features, or clinically if you watch, these children will be struggling with life. They have a low self-esteem, troubled to maintain the personal relationships. So many times they don't have friends because all the friends try to avoid them because of their activity. And then because of their poor attention and the way they behave, the school performance is also very poor. So because of all these two factors, they have a low self-esteem. Now there are different other conditions where the child may show hyperactivity. So that doesn't mean that child is also having ADHD. So those conditions are mild mental retardation, lead poisoning, iron deficiency anemia, thyrotoxicosis, psychosocial stresses like losing a family member, changing any environment, or failing any exam. And then sometimes drugs like phenobarbital, vigabatrin may also cause hyperactivity. So this can come as a differential diagnosis for ADHD. Now come to the investigations. The lab values are very limited. There is no role of EEG, CT scan or MRI. Sometimes investigation is done, that is to rule out the differentials or the conditions which is mimicking the ADHD. But there are some diagnostic tools which can be used for ADHD. Some famous tools are number 1, INCLEN. This means International Clinical Epidemiology Network. This is a standardized clinical tool which is developed by INCLEN Trust International, and this is used in India, so known as Indian tool. This was designed to help identify and diagnose ADHD, especially in resource limited settings, developing countries, and India mostly this is used, and all other developing countries also they follow this. And some other tools are Kono's 3 parent and teacher rating scales. So they have some rating scales, so according to that they try to investigate. Another is Vanderbilt parent scale. So here also the scale and scorings are there, so that is a format they can use. Now come to the treatment or management part, which is a most important and then most difficult also. So this is managed by multidisciplinary approach, where parents, teacher, pediatrician, behavioral therapist, psychologist and social workers are playing the main and important roles. So according to this is divided into few sectors. Number 1, behavior therapy. Number 2, pharmacotherapy. Number 3, educational support. And number 4, parental education and counseling. So these 4 part I'll be discussing in the subsequent slides. Let's start with the behavioral therapy. In the behavior therapy, try to, for the children who have ADHD, try to do only one thing at a time, so they can put some attention. Use positive reinforcement behavior. That means you praise the child if they do little bit good. You put star chart and reward them, and then just show them happy faces, and then the rewarding system is very helpful, or it gives a good result with the reinforcement behavior. Another is time out for undesirable behavior. So this time out is, I have already discussed in my previous classes, like to put the child alone for some time, and 1 minute for 1 year, 2 minutes for 2 years, not more than 5 minutes. You'll put the child alone if they are showing undesirable behavior. So this is a time out procedure you can practice. Another is just ignore the undesirable behavior. Just ignore them, they are just doing themselves, and then they keep quiet. Another is use distraction free environment for the child, because little thing also is distracting them, so you have to use the distraction free environment. And then social skill training you can do little by little, giving more attention to the child. Number 2 comes the pharmacotherapy or the medications used. There are certain medications we use. So number 1 is stimulant medications. So this is a prefrontal lobe stimulant to control the behavior of the child and help the hyperactivity. So this is helpful in 75 to 90% of the children. So drugs used are methylphenidate, amphetamine, dextroamphetamine. So these drugs, especially methylphenidate is used. So this methylphenidate is it's going to block the reuptake of dopamine and norepinephrine. So if they block the reuptake, the availability of dopamine is increased, so the behavior is controlled. Another group of drug you use is non-stimulant medication. So these are selective norepinephrine reuptake inhibitors, also known as NRI. So the drug commonly used is atomoxetine, guanfacine and clonidine. Atomoxetine is commonly used. So this drug is selectively is going to block the reuptake of the norepinephrine. That means availability of norepinephrine is more, and then in the prefrontal cortex, and it controls the behavior. And then sometimes in a very severe and aggressive child, even some atypical antipsychotics are used, like risperidone, aripiprazole are used for severe conditions. Otherwise commonly used drugs are amphetamine or methylphenidate and examoxetine is the commonly. Methylphenidate and examoxetine is, atomoxetine is commonly used drug. Now educational support, individualized education programs can be done. So this will be different for the different individual. So based on their clinical presentation, you can plan this. Another is accommodations like extra time. Give extra time to these children and make modified assignments for these children. Short assignments or in a smaller form you can give than the general class. Another is one-on-one or small group instruction. So full attention to a single child. That will be best. If that is not sufficient possible, then at least make small groups. And then study period should be brief for these children, with a constant feedback. Just let them do very small portion and then give them feedback. Try to give them positive feedback. Another is place them in front seat in the class so that they are near to the teacher, so they are given more attention, and away from the windows, doors, which may cause distraction to the child. Another is clear, concise instruction to the child. Very clearly, shortly you will tell, because longer sentences again their attention span is so short that they cannot take. So you have to give very concise instructions very shortly in a simple way. And then you can use visual aids like charts, diagrams, pictures for them to understand. Another is break task in small steps. So if the homework is for half an hour, you can just break those tasks in 10 minutes, that way very shortly for them. You have to design a special task. And another, lastly, frequent breaks between the classes. So the short structured breaks are going to improve attention, so they need frequent breaks. Parental and family education and counseling, because parents are so frustrated with the child's behavior. Child is not accepted anywhere in the society, so it's very, very difficult for the parents. So first, make the parents understand how it is, and you have to teach them, or parenting skill training is there that is required for the parents to handle and understand the child, and to handle the child and guide the child's behavior. Behavior therapy, the parents can also help. So you teach the behavioral therapy to the parents also, so that at home the parents can guide them and then make a better life for them and for themselves also. In summary, ADHD, to say ADHD, there should be persistent inattention, hyperactivity, impulsivity for at least 6 months, and starts in children before 12 years old. So all the hyperactive children are not ADHD. This you have to understand. Another is diagnosed if problem behavior is present in at least 2 different settings. This is important. 2 different settings, the group of people should be noticing those criterias, like home, school, in a play with the friends, in a social situations, or in a tuition class. So any 2 settings, if those criteria are diagnosed or noticed, then you can diagnose AD, and then you can say this is a ADHD case. Another is behavioral management is initial treatment modality for the child. Methylphenidate and atomoxetine are the most commonly used drug therapy, and best success rate is with combination of behavioral and drug therapy. So you give drug treatment also side by side behavior therapy, which is important, that you have to continue lifelong. Okay, thank you. I hope this class was useful for you. If you feel my class is helpful, please subscribe, like and share. Next class I'll do autism. Thank you.